Students, good morning to everyone. We are discussing the medicinal chemistry. In medicinal chemistry, therapeutic action of drugs. In the previous classes, we discussed the classification of drugs and all. In this video, we are going to discuss the therapeutic action of drugs. What are analgesics? What are tranquilizers? Antacids, antihistamines, antimicrobials, antibiotics, antiseptics. What are disinfectants? What's the difference between the disinfectants and antiseptics? So these all are the things we are going to discuss in this video. So let us start. Therapeutic action of drugs. So as we know, day by day, there was a huge developments in the biology. And these developments in the biology enable us to make new drugs which are more safe and also more efficient than earlier. So this more safe and efficient drugs can invent only after the detailed analysis of so many of drug actions and their mechanisms. So without knowing the complete analysis of the drug action, we cannot invent the new drugs. So this invention of the new drugs only possible after the detailed analysis of their drug action and their mechanisms. So now, for example, if you see, few are suffered with acidity. So acidity in the stomach is because of the secretion of more acids by the secretion of more bile juices like HCl in our stomach. And this secretion of acids in our stomach which causes irritation, pain in our stomach, ulcers, sometimes heavy acidity means causes what? Bleeding from the ulcers also. So this over secretion of acids causes irritation. So to prevent that, to relieve from this, what we generally take hydroxides of the metals like aluminum hydroxide, magnesium hydroxides. But these are making the stomach as into an alkaline medium. Why? Because they are bases. So if we use this aluminum hydroxide or magnesium hydroxide, after the usage of that, our stomach becomes what? Alkaline in nature. Because of making into alkaline nature, this alkaline nature triggers the generation of more acids. Of course, these relieves the symptoms, but they do not stop the cause of that symptom. So that is why. So after the detailed analysis of this, so acidity and to relieve the acidity, we are using the hydroxides of the metals, but the action of them, so after the detailed analysis of that, they found that the acidity is because of the presence of histamines in our body. Histamines. So when these histamines go and binds the active sites, that means what? Receptors. When these histamines go and binds the receptors in our stomach wall, they secrete the juices into the stomach. So the secretion of the juices means acids into our stomach only after the histamines go and binds with the receptors. So now over secretion of acids because of over presence of histamines or over binding of histamines to the receptors. Okay, so the histamines histamines enables the secretion of bile juices or acids into the stomach. Now what we are doing, we are adding drugs, and these drugs are structurally similar to histamines. The drugs we are using are structurally similar to histamines. Because of structural similarity, these drugs go and binds with the receptor sites in the place of histamines because of structural similarity. When these drugs go and binds with the receptors, what happens? That receptors becomes inactive. Once the receptors are inactive, they won't relieve the acids into the stomach. So by using these drugs, we are preventing the attachment of histamines to the binding sites, so that we are stopping the secretion or over secretion of acids into the stomach. So these drugs we call it as what? Antihistamines. Antihistamines. Now tell me, what is the difference between antacids and antihistamines. Antacids, they relieves what? Symptoms. Means immediately, suppose acidity is there. Immediately by using antacids, we can relieve from the pain, but we cannot control the cause of that. Why that acidity came? So antacids are used to relieve the symptoms, but antihistamines not only relieves the symptoms and also what? Stop the cause of that symptoms. So this is the main difference between antacids and antihistamines. So let us we briefly discuss few drugs and their therapeutic action and examples for them. So first one is antacids. Antacids. How you define the antacids? The chemical substances which neutralizes excess of acids present in stomach. Okay, so what these antacids do? They neutralizes the excess of acids present in the stomach. So excess, usually for the digestion of the food material, we need acidic conditions and some acids we need. Suppose if the acids secretes more than our requirements, then that excess acids cause acidity in our stomach. So to neutralize that excess acids, we are adding some chemical substances. Those chemical substances will go on neutralizes that excess acids. So this presence of excess acids, the presence of excess acids causes irritation, pain in abdomen, ulcers in stomach, and bleeding from ulcers. So these are some causes of this excess. Because of presence of excess of acids, they cause these problems. Now, these excess acids, as we know, I told you already, antacids can relieve the symptoms but not control the symptoms. So antacids, they relieve from symptoms but not control the cause. They won't control the cause, but they can relieve from the symptoms of the disease. Generally, which substances can use as an antacids? I told you already, the hydroxides of the metals. Why? You may get that out. Why hydroxides of the metals? In general, most of the hydroxides of the metals are insoluble in the water. Because of its insoluble in nature, they cannot, even after the addition of these hydroxides, generally hydroxides are what? Alkaline or basic in nature. Because of insolubility in nature, even after the addition of these metal hydroxides, they cannot exceed its pH more than its neutrality. So not more than 7. So because of that reason, we use generally the metal hydroxides. The metal hydroxides generally use as what? Antacids, because of their insolubility nature, and they cannot, the pH cannot be more than 7. Even after the addition of this metal hydroxide, the pH cannot be more than 7. That is why we are using these metal hydroxides as antacids. Let us see a few examples for this antacids. So let us take aluminium hydroxide, magnesium hydroxide, and the mixture of both. Okay, few tablets are the composition of both. Then some salts like sodium bicarbonate, magnesium carbonate, okay, and then magnesium trisilicates, and some artificial drugs like ranitidine, cimetidine, and omeprazole, and rabiprazole, etc. So these all are we are using as what? Antacids. Hydroxides of the metals like aluminum and magnesium, the mixture, or sodium bicarbonate, calcium bicarbonate, magnesium carbonate, magnesium trisilicates, ranitidine, next cimetidine, and then omeprazole, rabiprazole. So these are the few drugs we are using as what? Antacids. Next, move on to the next category, that is what? Antihistamines. I told you the antihistamines not only relieves the pain and also controls the cause of that pain. Let us see. So as I told you, the name itself, antihistamines. So these are the chemical substances which are acting against to the histamines, or which are acting along with the histamines. So let us see histamines first. If you see the structure of histamines, this is the structure of histamines. So what is the role of this? When this histamines go and binds the active sites of the receptors, the receptors will secrete the acids into the stomach. So when the histamines binds with the active sites, then only that active sites, that is, that the receptors will secrete the juices into the stomach. Now, these antihistamines, the chemical substances, antihistamines are nothing but the chemical substances which play the activity of histamines, which plays the activity of the histamines and makes receptors inactive. So in the place of these histamines, these chemical substances will go and binds with the active sites of the receptors. Once after they binds with the active sites, that receptors becomes inactive. So once they are inactive, they won't secrete the juices. So, and these antihistamines, they are structurally similar to each other. Because of structural similarity, they can go and binds with them. Generally, these antihistamines, where will we use? The antihistamines we use against for common cold. We use the antihistamines for common cold, conjunctivitis, next one, post-operative vomitings. Sometimes after the operation, the patient may get severe vomitings. So for post-operative vomitings, and nausea in pregnancy of women. During the pregnancy, few women get the nausea problem. So for nausea in pregnancy, also we use this antihistamines. Okay, so these antihistamines Also we call it as anti-allergic drugs. We also call what? Anti-allergic drugs. So some few are having allergy towards dust allergy. So for that also we use these antihistamines. Okay, next these antihistamines. What are the examples for this antihistamines? Examples, if you see, for cold generally we use cetirizine, levocetirizine, and Dimetapp. Okay, Dimat. So doctors call it as Dimetapp. So general the chemical name of this Dimetapp is bromopheneramine. And terfenadimine. Okay, this is what generally called as Seldane. Okay, so these all, and also Benadryl for cold and cough. We use the Benadryl syrup. So these are some examples for the antihistamines. Antihistamines also called what? Anti-allergic drugs. So these antihistamines not only relieves the symptoms but also controls the cause of the symptoms. And these are the substances which are structurally similar to the histamines, which go and binds with the active sites of the receptors and make them inactive and stop secretion of the juices into the, or excess of acid into the stomach. And they generally use this antihistamine for common cold, conjunctivitis, post-operative vomitings and nausea during the pregnancy. So these are the examples of antihistamines. Next, let us move to the next one, that is the tranquilizers. So before we start the tranquilizers, neurologically active drugs. So under the neurologically active drugs, we discuss tranquilizers and analgesics. Okay, so they both are neurologically active drugs. What are these neurologically active drugs and what the role they perform? If you see, neurologically active drugs are nothing but these are the drugs which transfers a message from nerves to receptors. So these are the drugs used to transfer the messages from nerves to receptors. So under these neurologically active drugs, we discuss tranquilizers and analgesics. Let us see the first one, tranquilizers. What are tranquilizers? I told you already, tranquilizers are nothing but these are the neurologically active drugs which transfers a message from nerves to receptors. Now, tranquilizers, generally the chemical substances which are used to relieve from following. What are those? Anxiety, stress or depression, excitement, okay, and dull, or some mild mental disorders, etc. The chemical substances which used to reduce or relieve from anxiety, stress, excitement, dull, or some mild mental disorders, that chemical substances we call it as what? Tranquilizers. So generally, when we feel overexcitement, so overexcitement is when there was more secretion of hormones, Because of more secretion of hormones, what happened? They transfer the message fast from nerves to receptors, so that we are getting overexcitement. Similarly, depression, because of less secretion of hormones. Less secretion of hormones leads to depression. More secretion of hormones leads to what? Excitement. Okay, and these all are to relieve from this all, we use what? Some chemical substances, this is what we call tranquilizers. For example, and these tranquilizers, and one more thing, when we use these tranquilizers in a smaller dose, suppose if you use in smaller amounts, then that is called, we call it as sedatives. Sedatives. When we use these tranquilizers as small doses, we call it as what? Sedatives. Sedatives, they don't give sleep. They won't induce a sleep. Okay, the person will not go into the sleep. Whereas hypnotics are nothing but when we use tranquilizers in large doses. When we use the tranquilizers as in a larger doses, then we call it as what? Hypnotics. Hypnotics. So tranquilizers are of two types: sedatives and hypnotics. Sedatives are nothing. When we call sedatives, when you take the tranquilizers in smaller doses, called sedatives. Larger doses called hypnotics. Now, hypnotics, they induce the sleep to the patient. If you use the hypnotic or larger amounts of tranquilizers, they induce sleep to the patient. Okay, so this hypnotics, best examples for hypnotic drugs. Hypnotic drugs are barbiturates. Barbiturates. What are barbiturates? Barbiturates are nothing but the derivatives of barbituric acid. The derivatives of barbituric acids are called what? Barbiturates. Under this, we mainly, what are barbiturates drugs? So that is what? Veronal, luminol, seconal, emetol, and nembutal, etc. These all are what? Barbiturates. Okay, so these barbiturates we generally use to cure what? Syphilis disease. So these are hypnotic drugs. Okay, next one, the drugs equanil, Valium, serotonin, EVS, equanil, Valium, serotonin. These are the three drugs which we use to reduce depression. So which we use to cure depression plus hypertension. So both to relieve from depression and as well as hypertension, we use any one of these three: equanil, Valium, and serotonin. And one more drug is called reserpine. Reserpine is a drug which we use to relieve from stress and BP. To reduce BP and also stress, we use reserpine drugs. So total here 5 barbiturates, 3 drugs which are used for a combination of depression and hypertension, and reserpine is used for reduce what? BP. So this is about tranquilizers. Next, move to the next analgesics. Analgesics. I told you already, this is also one more neurologically active drug. And what are analgesics? How you simply define analgesics? Simply pain relievers. Okay, suppose if you hurt your hand or leg, or if there was any pain, headache, backache, Okay, whatever it may be the pain you have, to relieve from the pain we use analgesics. So simply analgesics we call it as pain relievers. Pain relievers. So how you define analgesics? Chemical. So these are nothing but the chemical substances which uses to relieve or completely abolish pains in our body. Okay, that chemical substances we called as what? Analgesics. And what are the examples for this analgesics? Analgesics examples, see that these analgesics, so before I give the examples, these analgesics are again of two types. There are non-narcotic drugs and narcotic drugs. So okay, the analgesics are of two types. So those are non-narcotic drugs. The second one is narcotic drugs. So what are non-narcotic and narcotic drugs? Simple, I just differentiate these two. Non-narcotic drugs means, suppose if you wanted to cure the mild pains, suppose the pain is very less, to relieve from the mild pains like headache, backache, likewise, to relieve from mild aches, we use non-narcotic drugs. To relieve from high pains, means larger pains. For example, post-operative pains. After the operation, the patient generally get more pain. Or else the pains which are coming during the pregnancy, okay, after the during the delivery of the baby, so the pains, okay, those all are what? Heavy pains. To relieve from that high pains, larger pains, we use narcotic drugs. Generally, narcotic drugs are alkaloids and are toxic. Whereas non-narcotic drugs are non-toxic. They are not toxic. They won't give any side effects. Okay. And one more thing, non-narcotic drugs. Non-narcotic drugs are used to cure mild pains, and also they do not induce the sleep. Suppose if you take the non-narcotic drug, they won't get, the person will not get sleep. Okay, they will not induce sleep. But if narcotic drugs if we use, then the patient will go into the sleep. So they induce the sleep immediately after the intake of these narcotic drugs. The person will get into sleep. Okay, so non-narcotic drugs and narcotic drugs, and they are less efficient, whereas narcotic drugs are efficient but they are toxic. So over usage of narcotic. And one more thing, non-narcotic drugs are non-addictive. Okay, there was no problem. Even if you take frequently also, there was no problem. So they are non-addictive. But narcotic drugs are addictive. It's very, very, very important. Addictive drugs. Once they start using these narcotic drugs, they always keep on using that. They will be addicted to the drugs. So that is why non-narcotic drugs are non-addictive, whereas narcotic drugs are addictive. Non-narcotic drugs are what? They will not induce sleep, whereas narcotic drugs will induce the sleep. And non-narcotic drugs are used to cure the mild pains, whereas narcotic drugs are used to cure what? High pains, larger pains. And examples for the non-narcotic drugs. First I will give the examples for non-narcotic drugs. So what are those? Best example, you take aspirin, paracetamol, and then naproxen, IB, that is ibuprofen. Doctors call it as IB injection, ibuprofen, and diclofenac, sodium or potassium, anyone. Sodium salt of diclofenac or potassium salt of diclofenac, or the compounds of salicylic acid, phenol, aniline, quinoline, etc. These all are what? Non-narcotic drugs. Aspirin, paracetamol, naproxen, ibuprofen, diclofenac, diclo tablets, or diclofenac, sodium or potassium. These all are what? Non-narcotic drugs. In that, aspirin. What is the chemical name of aspirin? So it is nothing but acetyl salicylic acid. Acetyl salicylic acid is called what? Aspirin. And this aspirin, intake of aspirin in empty stomach causes ulcers. So we should not take the aspirin in empty stomach. And one more thing, there was one more advantage with this aspirin. Aspirin is used to prevent the blood clotting. To prevent blood clotting, they use aspirin. That is why whenever a patient gets heart attack, immediately they give aspirin to them. So aspirin, the heart attacks generally for the clotting the blood in a heart, generally. So to prevent that clotting of blood, they immediately use aspirin. Okay, so this is one. And paracetamol, you know, what is the chemical name of paracetamol? It's nothing but N4-hydroxyphenyl ethanamide. So I just draw the structures of both aspirin and paracetamol here. So aspirin, this is what? Salicylic acid. So what is the name of aspirin? Acetyl salicylic acid. So this is acetyl group and this is salicylic acid. So acetyl salicylic acid. Acetyl salicylic acid we call it as what? Aspirin. Next one, paracetamol. Paracetamol name. This is what? Ethanamide. To this N group, there was a 4-hydroxide. So N, to the N group it was attached. N in the bracket, this is what? 1, 2, 3, 4. At the fourth position, hydroxy group is there. So 4-hydroxyphenyl. 4-hydroxyphenyl. Next, the name is ethanamide. Ethanamide. So this is what? Chemical name of paracetamol. So this is what? Non-narcotic drugs. Next, narcotic drugs. So best example, they are alkaloid, they are toxic in nature and they are addictive. If you use it for few times, they keep on using for longer times. And examples for narcotic drugs: morphine, codeine, heroin. Not heroin, heroin. So morphine, codeine, heroin are examples for what? Narcotic drugs. Let us draw the structures of these three narcotic drugs. The first structure, morphine. These three narcotic drugs are having the similarity in their structure, only with one difference. Let us see. If you see the morphine structure, This is what morphine structure. Here simply remember OH group and OH group. Two OH groups are there, and there was a tertiary amine group is there. See, next codeine. Codeine means if there was codeine also called morphine acetate. So one of the OH group is replaced with acetate group. So this is what morphine acetate group is called what? Codeine. Suppose if the two OH groups are converting into acetate groups, morphine diacetate. So if this OH also replaced with OAC, then morphine diacetate we called as what? Heroin. Okay, this is a structure. If both are OH groups, morphine. If one OH group is becoming one OAC, acetate group, codeine. If two OH groups are converting into acetate groups, that is what? Heroin. So all these three are alkaloids and toxic or narcotic drugs. Next, move to the antipyretics. Next drugs, next category, antipyretic drugs. Antipyretics also called. Antipyretics. What are antipyretics? The drugs which we use to reduce the temperature, body temperature during fever. Okay, to reduce the body temperature, whatever the drugs we are using, that drugs we called as what? Antipyretics. The chemical substances used to reduce body temperatures during fever. Okay, so that drugs we called as what? Antipyretics drugs. So what are the examples for the antipyretics drugs? That is what? Analgin, phenacetin, paracetamol. See, paracetamol is not only used as what? Analgesic, it also used as what? Antipyretics. So the analgesics, few of the analgesics can be used as anti-inflammatory and also antipyretic drugs. Among that, the best example, paracetamol. Paracetamol can be used as an analgesic, pain reliever, and as well as what? To reduce the body temperatures. So these are the examples for antipyretic drugs. Next, move to the next one, antimicrobials. Antimicrobials. What are antimicrobials? So, as a biology student, you know the pathogens. What are pathogens? When we call the pathogen, whenever a foreign body means outside of our body. It may be a living or non-living substance, whatever it may be. Whenever a foreign body enters into our body, then that foreign body we called as what? Pathogen. And this pathogen may be living or non-living, whatever it may be. If it is a living, it can be a bacteria, it can be a virus, it can be a fungi or any other microbe, whatever it may be. So when this foreign body enters into our body, this foreign body starts synthesizing few of the chemical substances in our body, which alters our body metabolism. With that, the person will become what? Ill. To prevent that, some of the chemical substances used to prevent the synthesis of the chemical substances by these pathogens. And those chemical substances we called as what? Antimicrobials. So antimicrobials are nothing but the chemical substances used to kill. Maybe this chemical substance will go on directly kills that pathogen, may kill or reduce the effect of pathogens or microbes in our body. Okay, so the chemical substance used to kill or reduce the effect of the pathogen or microbes in our body, that is called what? Antimicrobials. And these antimicrobials, it can be antibacterial, antifungal, antiviral, and antimicrobes, etc. Okay, any other pathogen called antimicrobes? Antibacterial, antifungal, antiviral, and antimicrobial. So among that, the most important is what? Antibacterial. And one more thing, these antibacterials are of two types based upon their synthesis. Some of these antimicrobials are naturally synthesized in our body, and some are artificially introducing into our body. So these are of two types. Those are natural antimicrobials and synthetic or artificially antimicrobials. Natural antimicrobials. What are examples for the natural antimicrobials? Lysozymes, HCl. Okay, so best examples for natural antimicrobials. Microbes. Suppose HCl secreted in our body. Whenever a foreign body enter into our body, that will go and that HCl will kills them because of less pH, acidic pH. So lysozymes and HCl naturally synthesized in our body and they kills the microbes. Whereas synthetic antimicrobes, examples, penicillin you take, penicillin, and then sulfadiazamine, chloramphenicol, etc. So these all are examples for synthetic, we will discuss later. So this is based upon their origin. Antimicrobials are of two types, natural and as well as synthetic. Now let us discuss antibacterial in detail. So in this antibacterial, some of the antibacterial are maybe antibiotics, antiseptics, and disinfectants, and some sulfur drugs, etc. These all are what? Antibacterial drugs. So what are those? What are the examples for antibacterials? Antibiotics, antiseptics, disinfectants, and sulfur drugs. These are the best examples for what? Antibacterial drugs. So in that, the first one is what? Antibiotics. You know the concept of antibiotics. What are antibiotics? Antibiotics are nothing but these are the chemical substances secreted by the microorganisms, are using to kill or prevent the other microorganisms, maybe same or other. These are the substances which are secreted by the microorganisms and are using to kill or the prevent of effect of microorganisms. So that substances we called as what? Antibiotics. And these antibiotics are used to kill the bacteria especially. And these antibiotics are of two types based upon their role. They are broad spectrum antibiotics, narrow spectrum antibiotics. What are broad spectrum antibiotics? Broad spectrum antibiotics are nothing but the antibiotics which are more efficient towards more efficient and widely used for other bacteria, widely used for many bacteria. That's called broad spectrum. Whereas narrow spectrum means it's efficient only towards either gram positive bacteria or gram negative bacteria. So they are not widely used for many bacteria, they are using only for a particular bacteria. So its usage is narrow, so called narrow spectrum. Broad spectrum antibiotics and narrow spectrum antibiotics. So examples for the narrow spectrum, especially, that is a penicillin G. Penicillin G is the best example for narrow spectrum antibiotics, and broad spectrum antibiotics. So remaining all penicillins. Penicillin, generally penicillin 1, 2, 3, 4, 5, 6. Total 6 types of penicillins are there. In that one is narrow, remaining all are what? Broad spectrum. So penicillin 1, 2, 3, 4, 6. This is the 5. Next one, chloramphenicol. Next, ofloxacin and sulfadiazamine, and then streptomycin. Streptomycin is a drug which we use to cure tuberculosis, TB. Streptomycin, ampicillin, amoxicillin. So these all are examples for broad spectrum antibiotics. Okay, so this is about the broad spectrum and narrow spectrum antibiotics. Next, move to the antiseptics. Next, antiseptics and disinfectants we both discuss comparatively. Antiseptics. So the role of antiseptics and disinfectants are almost the same. So they both are used to kill or reduce the effect of microbes. Okay, so both antiseptics and disinfectants both are useful to kill or reduce effect of that microbes, but antiseptics are used on surface of living tissues. So directly we can use the antiseptic on our surface of living tissues, but disinfectants cannot use on living tissues. They are used only in non-living surfaces. Non-living surfaces means floor, okay, floor cleaner, bathroom cleaner, etc. Okay, so they are using on the surfaces of living tissues, on non-living tissues. Next one, these antiseptics that do not orally intake, cannot take orally. Of course, even disinfectants also cannot take orally. Both cannot take orally directly. Okay, and these antiseptics, examples, and one more thing, few antiseptics can act as a disinfectants in their high concentrations. When the substance in lower concentration act as an antiseptic, higher concentration act as what? Disinfectant. Let us see. For example, examples for antiseptic here I am writing. Soframycin, funosine, Dettol, then tincture of iodine, iodine tincture, Savlon, iodoform, etc. These all are what? Antiseptics. See, if you take the Dettol, Dettol is the mixture of, it's very very important, chloroxylenol and terpineol. Mixture of chloroxylenol and terpineol. And if you see the structure of chloroxylenol, this is xylenol and this is chloroxylenol, and terpineol. So this is what? Terpineol. So the mixture of both we call it as what? Dettol. And a tincture of iodine. Tincture of, when we call the tincture of iodine, when we mix 2 to 3% of iodine in alcohol or water. So this mixture we call it as what? Tincture of iodine, and iodoform, this all we know. So this is about antiseptics. And examples for the disinfectants. Disinfectants examples, if you see, you take the phenol. Phenol. When you take phenol in 0.1 to 0.2%, we use as a antiseptic. When it was 1%, we use as what? Disinfectant. And the sulfur dioxide. Sulfur dioxide generally cannot be used in unliving tissues, so we cannot use as an antiseptic. We use this only as what? Disinfectant. Even chlorine also. Chlorine. So these are some examples for disinfectants. And the last one, anti-fertility drugs. Anti-fertility drugs. What are anti-fertility drugs? Simply birth control pills. Anti-fertility drugs are nothing but what? Birth control pills. So what are anti-fertility drugs? These are the chemical substances used to check pregnancy. Check means to stop. These are the chemical substances which we use to check the pregnancy of women. How they check the pregnancy? These are the drugs which secretes few hormones, and that hormones will go on prevents ovulation or fertilization. These hormones will go on to prevents ovulation of ovum or fertilization of ovum. So that is, so the secretes hormones and prevents ovulation or fertilization. So likewise, they stops the pregnancy in women. So they are generally birth control pills. So generally, what are the substances we use as anti-fertility drugs? So it's a mixture of synthetic estrogen and progesterone. The mixture of synthetic estrogen and synthetic progesterone, that mixture we can use as what? Anti-fertility drugs. Some examples for synthetic estrogen drugs. Synthetic estrogen drugs. Example, ethinyl estradiol, menstrual are examples for synthetic estrogen drugs. And the synthetic progesterone drugs are norethindrone and norethindrone, etc. So these are the few examples for synthetic progesterone drugs. The mixture of both we use as what? Anti-fertility drugs. So these are the drugs we use in this topic. Once again, we started with antacids, next antihistamines, then tranquilizers, and then analgesics, then antipyretics. Okay, after antipyretics, antimicrobes, under the antimicrobes, antibiotics, antiseptics, then disinfectants, and finally we wind up with anti-fertility drugs. I hope you understood this topic. So the next topic we